Sometimes you're offered an extraordinary privilege, and thanks to Stella, I have been offered the privilege of introducing Lee Hussey. She's come here to share with us the ultimate gift that you will ever give to someone in the world. I have read many articles about our speaker, and let me quote from just one of them. Lee Hussey knows the polio. She hurts every day walking with a limp because one leg is shorter than the other. But she can walk, and walk she does. Through the heat of the sun and from the very early morning, Lee Hussey leads the Rotary National Immunization Days into some of the toughest parts of the world. She has done this now more than 25 times. She's traveled twice to Venezuela to work with children with cleft lip and cleft palate, but her real mark has been her travel to India, Egypt, Mali, Niger, Nigeria, and Bangladesh to work on the National Immunization Days and the volunteer teams. Twice, our district governor, Stella, has shared the journey with Lee, once to Nigeria and this year to India. There are no superlatives to describe the awards she has received. In May of 2005, she received Rotary's highest honor for individual Rotarians, the Service Above Self Award, and in June of 2006, she received the Rotary Foundation International Service Award for a Polio Free World. Lee is a veterinary technician who works with her Rotary husband, Michael, and they own the Village Veterinary Clinic in Rollinsford, New Hampshire. They reside in South Berwick, Maine. Ladies and gentlemen, fellow Rotarians, please welcome a true world leader in the steady and successful drive to end polio in the world, one child at a time. She knows better than any that is your presence, not presence, that truly counts. Fellow Rotarians, our Rotarian, Lee Hussey.
Thank you, thank you.
Yes or no?
Yeah, I'll be sure and spill it, but thank you.
Will I leave it there?
No, it's okay. It's okay. Good, good, good.
I'll be your water boy.
I always wanted a water boy. No, I'm good. Well, hi, everyone. It's really good to be back. I was here 2 years ago, and it's a pleasure to be with all of you again. I met several of you that time, and I hope to meet everybody else this time, so please do introduce yourself to me. I would love to talk with you. I am here to share a little bit of my passion. Everybody thinks I have a passion for NIDs, but it's really not. It's not about that. It's the passion for what the NIDs accomplish and the people you meet and the way that you see Rotary alive and well in the world and how much it means to everyone when we're out there. So my passion encompasses many, many things, but certainly the alleviation of the polio virus, of the suffering of polio survivors, and making sure that no child ever will be afflicted again. We are just coming off what's known as World Immunization Week. I don't know if any of you were aware of that. It just stopped April 30th. It was a week to bring awareness to the fact that 1 in 5 children still miss out on routine life-saving immunizations. And we certainly should be able to bring that to the fact that all children receive life-saving vaccines. And we could save easily 1.5 million children if every child were to receive these vaccines. This week brought awareness to this fact and also brought vision to the fact that hopefully by 2020, all children will receive vaccines that are necessary. I'm also privileged to speak to you today. Last month in April, we marked the 60th anniversary of the first polio vaccine by Dr. Jonas Salk. And that's how come I knew that wherever that speaker went to. It was one of the largest medical advances in American history, and it led to the rapid decline of polio cases in the developing world, including right here in Canada. We owe, at least I feel we do, a lot to Franklin Delano Roosevelt, a former president of the United States, who was instrumental in establishing what we know better as the March of Dimes. And it was the fundraising effort of the March of Dimes that led to the research and the development of that first polio vaccine. They were searching for a cure. We know there is no cure. Really, there never has been a cure, and there never will be, but it's preventable, and that's the key, and that's what we aim to do. But the March of Dimes gave us not only Dr. Salk's first vaccine, the injectable, but also later Dr. Sabin's oral vaccine that we have used so widely in our eradication efforts. It was in April of 12th, 1955, when they made the announcement that Dr. Salk's vaccine was effective. That news came out of Ann Arbor, Michigan, and I will tell you that the world just rejoiced. People cried tears of joy. They rang bells. They turned on every siren and whistle that they could do. And people just streamed out into the streets because of the relief that they felt, that they would never have to suffer, their children would never have to suffer from polio again. It was, at the time, the height of America's faith in research and in science. In America, and eventually the whole world, was changed. And vaccines soon became a part of pediatric care. Fast forward to today, where in America and other developed countries, we see a resistance to vaccines growing. This is my one political statement I'm going to make, and then I'm done. But we have become a victim of our own success, with a generation who's never witnessed the rampage of diseases known to previous generations, to many here in this room. So I urge all of us as Rotarians to be well-versed in the benefits of vaccines and help to educate others in protecting all children everywhere. Thank you. I think our thoughts today should be with the people in Nepal. We all know of the terrible trauma that's going on over there. But I wanted to bring out to the point that our polio infrastructure has been closely involved in the relief efforts there in Nepal. Polio staff are always among the first to be on board when the emergency or crisis hits. That happened previously in Pakistan when they also experienced an earthquake a couple of years ago. Because it's the polio workers who have the local knowledge. They know where the families are, they know how to locate the homes, and they have strong systems in which they can monitor and implement response. So it's just another way that our polio program is changing the world and will continue to change the world. And you'll hear me say that probably more than once. 2014 was a mix of good and bad in our polio eradication efforts. I think mostly good overall. Never will we forget the monumental success of India being declared certified polio free. And then that was a year ago, actually, this last February. And personally, I salute the Rotarians of India. If any of you have ever been there to work with them, alongside them in their efforts, their determination and their hard work really, truly helped them to achieve the status of a polio-free India. Thank you. As an NID volunteer, I know this wouldn't have happened without the army of Rotary volunteers. Not only their advocacy efforts, but their grassroots efforts of talking to individual religious leaders and local and political leaders really was the key. But as your governor has already written in several things, the unsung heroes are truly the health workers. And 80% of those health, 85% of them actually are women. And so our hats off to the unsung heroes in all the immunization campaigns around the world, because they're the ones that are truly leading the cause. India has to remain vigilant, even though there have been 4 years without a polio case. The threat of polio coming back is very clear and evident because of their border with Pakistan and, of course, their close proximity to Afghanistan. So India continues to have routine immunizations twice a year for the whole country and 3 or 4 times the rest of the year in areas where they're most at risk for reinfestation. For the last decade, Nigeria has been the only endemic country in the African continent. Over years, they've managed to infect 26 other African nations, sometimes repeatedly. And actually, it has remained the continent's last polio reservoir until, I would think, today. Because Nigeria, and perhaps Mike McGovern already told you this, but they have now completed 9 months without a single polio case in Nigeria. And even better than that, they cannot find the wild polio virus in any of the environmental samples coming out of Nigeria. All good news. This is definitely a milestone, but it's not close enough. And I'm sure you heard the word fragile come out of Mike McGovern's mouth, because that really is the situation in Africa. It's a fragile situation. But we should remain hopeful of the prospect of a polio-free Nigeria. If they continue along this success, they'll come off the endemic list by the end of July, but they must complete 2 additional years without a polio case to be certified polio-free. They are staying the course. They're constantly increasing and strengthening their surveillance and reaching the, bridging that gap of missed children, and we're trying to reach every child now. And they're making tremendous progress, and I can't wait to be back there this fall to work alongside them. Nigeria also remains proof of how the infrastructure that our polio program has put into place continues to play a role in all of our health initiatives. They were able to stop the Ebola virus when it entered into Lagos in the southern part, the most populated city of Nigeria. And Nigeria is the most populous country in Africa. But they were able to keep that Ebola virus from spreading, and it was a remarkable work done exclusively by following the same lessons that we've learned in the polio eradication efforts. You will hear about emergency operations centers constantly. That's how we're operating today in these countries. They set up an emergency operations center just for the Ebola crisis, and it stopped it dead in its tracks. So our hearts off to them, hats off to them. I just want to take a moment to stress that disease surveillance is really a major component of our program. It's actually the lifeblood of the Global Polio Eradication Initiative. We wouldn't be where we are today if we had not created this surveillance system of 147 laboratories around the world. Because we need to know at all times where that virus is, whether it's in a case of polio or whether it's just showing up in an environmental sample. And it's the surveillance that allows us to do this, allows us to track it real time, to know that precise knowledge of when and where and what's happening with that virus. It is an instrumental tool that provides a clearer, broader epidemiological, I think that came out right, picture. And so it's really, truly something that we need to focus on, because you will find that as we move forward in our eradication efforts, that we're going to be putting more and more time and money into that surveillance program in order to achieve global certification. The other thing that I think is the most valued part of our eradication efforts is the trust that we have built up in these countries and the hope that we have brought to so many. It is a valued commodity for social mobilization, for stopping the spread of the virus, to be able to gather data, and to be able to talk with families. It's the trust that we have achieved that really brings us the success where we are today. And we will continue to build that trust and to build resilience. And I think that's a key word that you may hear more about in the coming years. The resilience to have for these countries to maintain their better health infrastructures so that they can move forward when our eradication efforts are completed. The situation in the rest of the African countries, again, is fragile. We remember in 2013 all of the outbreaks that we had over there in Central Africa and East Africa. And those are gone. I'm happy to say that there has been no cases in those countries in 2014, except, well, actually, it's been 9 months since the last case came out of Cameroon and Equatorial Guinea. And they're moving on there. They're immunizing, again, closing that gap and doing better surveillance there. Cameroon is really challenged by over 200,000 refugees that have come out of Nigeria because of the terrorists up there, and out of Chad, and also out of the Central African Republic, where there's lots of insecurity and crisis going on there as well. And even in the Horn of Africa, we have countries that are at risk: Somalia, Ethiopia, Congo, Kenya. They all remain at risk, and immunization campaigns continue to be supported there as we move forward. I think Mike also talked a bit about Pakistan. I think it's one of our biggest challenges, but I don't think it's an insurmountable challenge by any stretch. Efforts are ongoing there to strengthen their emergency operations centers. They now have more effective ones than they've had previously. Their focus is truly on missed children, not only in just the regular planned immunization campaigns, but in between. They are focusing on areas where they know there's been missed children, and they're reaching out to those families on a constant basis. I think in 2015, you will see that situation improve. Nothing can be compared, though, to the loss of lives that we've experienced in Pakistan, and never did we ever think that the guns would be turned on our program. At least I sure didn't. But I like to think, and I believe, that it's not just the polio program that they're fighting. I think it carries more than an anti-polio agenda in that instance. But the virus is still loose in all of Pakistan, even in the districts where there may not be a polio case. We all know that there are children out there spreading the virus. They're just not showing symptoms. And Afghanistan is the same. We also still have the circulating wild polio virus in Afghanistan. And we're moving forward with them just as we are with Pakistan. So I think we are poised to have a really good year in 2015, and that's what I'm counting on. So. Also, we know in 2013 that Israel, the West Bank, and Gaza all had polio virus showing up. Again, we reached a year with no detection of that polio virus in that area either. So these countries are no longer infected, but they're vulnerable to actually the polio virus coming into their areas if we're not maintaining good immunization efforts. And even as we speak, we have people over in the Ebola countries of Liberia, Guinea, and Sierra Leone now working on polio campaigns as they fight the Ebola virus at the same time in hopes of not having a polio outbreak in those countries, which would really be disastrous at this point. So prevention is definitely the key there as well. We have in place what's known as an endgame strategic plan. It was developed in 2013. It carries us, hopefully, to the goal of global certification by 2018. It's a comprehensive long-term strategy. It's actually undergoing a mid-year review as we speak. But I think that this endgame strategy is what we're following, and we're paying close attention to it. And I don't want to get into all that detail because you really don't need to know all of that. But I think one part of it that you should be aware of is that we are switching over to the injectable vaccine. We've already started to do that. In countries that have been polio-free for many, many years, they're turning them over to using the injectable versus the oral. And even in the endemic countries, it was the injectable that got India over the hump. It's been used in northern Nigeria to knock their numbers down. It's now being used in Pakistan. And the focus here is that we used the oral for so many years because of the protection it gave the digestive system in the stomach, in the gut, which is where the polio virus likes to replicate and infect children. So we still will continue with that in areas where we need to, but in the injectable vaccine will then give us a systemic approach. And as many of you know, we have 3 strains of polio, and type 2 has been gone since 1999, type 3 since 2012, the end of 2012. By using the injectable, we can ensure that cases of those 2 strains will never show up again. So that's another bonus for that. So if you've never been on an NID and you really want to go, I suggest you start making plans, because a couple of years and you won't be able to give oral drops. You'll be giving injections. So there you have it. I think I talked about the times in this, I'm going back to a previous time now, in the 30s, 40s, and 50s. I talked to you about this before, when the fear of polio used to lay heavy over every home. And I'm repeating this for the young people in this room, because it was a real threat when parents would keep their children away from public areas, playgrounds and swimming pools, in an effort to try to keep them from the polio virus. I contracted polio at the age of 17 months, living in South Berwick, Maine, exactly where I live now. And at that time, it was the largest epidemic on the east coast of the US, centered in Boston and the surrounding suburbs. But because parents had such a fear for their children, they used to take them away, to go out into the country for the summer. I have friends who say that they never saw their friends from school all summer long because their parents would hide them or whisk them away. So it actually helped to spread that polio virus up into a more rural area where I live in Maine. I'm not going to go into a lot about me, but let's just say that I feel very blessed to be standing here today. I was initially paralyzed from the waist down at 18 months. I spent several months in the hospital. I constantly give thanks for a wonderful mother who took wonderful care of me. I can't recall actually having the disease at that time, that frightening experience. My earliest recollections are all the many surgeries I've been through, get well cards that came constantly while I was there. I have scrapbooks full of those. Cold institutional hospital rooms. A memorable janitor named Mr. Clark. He used to carry me up the stairs at school. Heavy, awkward plaster of Paris casts. Any of you remember plaster of Paris casts? They were always hot and itchy, but you'd be surprised how far a ruler could reach when you're a kid and you got an itch. Nurses with really big needles and constant physical therapy, and a wonderful woman named Mrs. Woodbury, who really taught me the meaning of how to give and how to receive. I think this was my first exposure to the Rotary Foundation method of $2, you know, changing a life. This woman sent me a card. Every day I was in the hospital, I received a card from her. And on every holiday, Christmas, Easter, my birthday, whatever, I received a card, and she always tucked $2 into that card. And she never really understood, I don't think, the impact that $2 has had on me since that time. And it wasn't until I was headed off to college that I stopped in to see her at her house, because she was a total stranger up until then, other than being pen pals. And this was a woman who lived in a very normal house. She had no money. She was not rich. She could have used improvements in her home, but yet she was willing to give me the time and the attention and her money for over 30 years. And that, to me, until she died, I used to receive this, and even as I was a young adult. And so that was my first introduction to how $2 can change a life. And believe me, it's changed mine, and I urge you to continue with that so you can change lives as well. When I was young, I used to visit a local rehab center. I had to go there 3 times a week. But again, it was my mom who also did therapy with me at home, and I owe so much to her. Something as simple as my mom's purse hanging off my foot. It was filled with sand, and I had to keep lifting it in an effort to build up those muscles. I need her back here so she can keep me going again. I used to wear a brace on my right leg that went attached to my shoe, and the heel of my shoe went up over my hip. In time, it was to just above my knee, to below my knee, until after I had a surgery in 3rd grade, and we threw those braces away. And it was a special time that we did that. In some ways, I wish I still had them, just as a reminder to be able to use, but they're gone. I've lived with limited range of motion in both my ankles, my right being surgically fused at a very early age. My left used to exhibit what's known as a typical dropped polio foot, where you basically walk on the ball of your foot as you're going. And over time, of course, that Achilles tendon just began to get tighter and tighter, and my balance became worse and worse. I found a wonderful doctor in Baltimore. If you ever need your foot operated, call me. He's a wonderful guy. He did major reconstructive surgery, and I can stand here with my left foot flat on the floor. So I owe him my balance today. I'm very happy with that. Thanks, Phil. I've lived through the taunting of childhood peers. I think anyone with any kind of a disease sometimes has to live through that. Children can be cruel to their peers. I was the only child in my school with polio, one of the last cases of polio in our area. I grew up being different. Today I embrace being different. The mimics of my walk, the staring eyes, even now as I walk down the street, people are always looking. The frustration of buying shoes, especially as a woman. The challenge that climbing stairs always and still presents. When cripple was still a common term, and much, much more that we're not going to go into today. But let me just say that having polio has truly made me, I think, in some ways, who I am today. Not totally. I don't want to be identified just by polio. But it does have a tendency to make someone stronger and more determined. And that's what it's done for me. I used to basically try to ignore the fact that I had polio and hope that others would at the same time. Now, I only briefly mentioned my experiences with polio, because we all know, and you've seen in some of these pictures, people who are far more affected than I. So when I learned of Rotary's initiative to eradicate polio, it seemed only natural that I should become involved. I was intrigued. So I traveled to India on my very first National Immunization Days campaign in January of 2001, before I joined Rotary. And there I witnessed firsthand the devastation that polio was still bringing to the people of India. I saw crawlers, young and old, begging in the streets, dragging themselves with their hands in their arms. Their legs were just twisted in unimaginable contortions. Some wore sandals on both their hands and their feet, walking on all fours like animals, stripped of their dignity. And quite honestly, all I could think of was how, selfishly, all I could think of was how fortunate I had been to have had polio in the United States and not in the slums of India. I met a young girl on that first trip with a rehabilitation center where they were parading out these children to show us what they were doing as far as braces and crutches and things, the ways that they were helping them. This young girl, about the age of 9, came by me, and she had the most beautiful smile, and I can still see her today. And I looked at her, of course, and smiled back at her, and then I gazed down at her leg showing beneath her skirt. And there I saw that same thin right leg, that same heavy metal brace, and I was instantly overwhelmed by memories of myself at her age. And I started to cry. And as I looked back up at her face, she was still smiling at me as the tears streamed down my cheeks. She seemed to understand, actually, my own personal pain. And I cried for her, and I cried for me, and I cried for all the senseless waste that polio has brought to so many for so long. And that was my Rotary moment, before I joined Rotary, that I knew that I had to do all I could do to save other children from experiencing the same. Since that time, I feel truly blessed to be a part of Rotary's program, to have traveled down so many roads, mostly dirt, around countless corners and over oceans. And in my travels, I have learned many, many things. First of all, that people everywhere want the same, and their simple wants, a healthy life and to be happy. And mothers are definitely the same no matter where you go. I've also learned about poverty and how it takes just a very small amount of money to make a tremendous difference in the life of someone in the developing world. I've seen children and adults crippled from polio, and I've shared their agony as I watched them perform just the simplest task, simply trying to walk across the room. And I've learned how they may never see a doctor until they are a teenager or a young adult, if they ever see a doctor at all. I've learned that rehabilitation facilities exist in very few places, and where they do exist, those who need them the most cannot afford to attend. And I've discovered that accessibility for the disabled is basically non-existent in many countries, and actually could use some improvement in our own countries, and I speak for Canada and the US on that one. I've seen children born in the shadow of a hotel that charges $150 a night, who will never be able to attend a school that only costs about 10 cents a day, and their chances are even less if they are a girl. And I remain impacted by the sharp contrast, the renowned beauty of the faraway lands I've been able to visit, and the images of their suffering children. And I have witnessed so many Rotary grants and projects that have brought the Rotary Foundation right to life before my eyes. Believe me, if you've never had the opportunity to travel and see what your foundation dollars are doing, take my word, they have a huge impact. And there's no end to what those dollars can accomplish. And I have experienced guilt. Guilt that I am wealthy enough to be among the givers and not the takers. Guilt that by the grace of God, I was born in a safe, secure town with medical care and not in the slums of a forgotten city. Guilt that there have been times when I used to wish I had more, as I now gaze out upon those who have nothing. But most importantly, I have looked into the eyes of thousands and thousands of children, and I know why this program is so important and why we will continue until we reach our goal. Today, there are thousands of polio victims crawling on their knees, scooting on their buttocks, dragging themselves on their stomachs, with little hope of ever receiving assistance with their mobility issues. I cannot immunize in any village without finding a polio survivor, knowing full well that there are many more, but they're simply hidden by their families. There are an estimated 12 to 20 million polio survivors living in the world today, and one thing I would like you to remember is that polio lives with them forever. There remains a living legacy of this disease, and I've talked to you about it before, called post-polio syndrome. For polio survivors, this is a condition that will affect survivors after the recovery from the initial paralytic attack. These symptoms can occur anywhere from 20 to 40 years after that initial attack and will occur in well over 60% of all polio survivors. This condition is much more recognized in countries like ours, where the average lifespan is much greater. But believe me, it's already beginning to grow into a more serious global challenge in the wake of the polio epidemics around the world. Polio survivors like myself, who've been able to throw away their crutches and their braces, suddenly find themselves slipping backwards. Extreme fatigue will set in, pain will be experienced in both joints and muscles, and those muscles that we previously thought were unaffected begin to fail. These physical symptoms can be severe enough to alter your work function significantly and impose major lifestyle challenges. After successfully overcoming the effects of polio once, to face yet again a new debilitation and know that polio is interrupting your life once again can truly be demoralizing for many. To put it in really simple terms, for a person with polio to walk from that end of the room to that one, for a person takes twice as much effort for my muscles as it would for a person without polio. Because we have fewer muscles to work with, they're just simply wearing out faster than the normal aging process. My Uncle Marlon spent the last 10 years of his life as a quadriplegic, living in a nursing home, unable to even feed himself because of post-polio syndrome. And I and thousands of others live with this fear of incapacity and isolation every day. As long as we allow polio to continue anywhere in the world, there will continue to be polio survivors. Our polio program stands as a proud Rotary Peace initiative. And as I said, it's built trust and offered hope to many. And it's truly a grassroots effort that's changing the world. Has our program created conflict? Sure, at times it has. Weak methods, poor diplomacy or lack thereof, poor follow-through, unfounded rumors have unintentionally created conflict and misunderstanding among resistant cultures. But it's for sure that that polio virus has no favorites, and it will attack rich or poor, black, yellow, red, brown, or white. And so we carry on, children. The recent violence that we've seen in the areas of the endemic countries, and undoubtedly more that may follow, may cause a slight setback in our activities, but it will not deter those who are dedicated to the cause. So this afternoon, I ask you, who else in the private sector could have taken up the largest humanitarian effort ever, affecting the entire world, and stayed with it all these years when those challenges oftentimes seemed insurmountable? An effort that we conceived, and we enlisted the health agencies of the world to join with us, and we actually helped to self-fund it initially. Where else will you find 200 nations working cooperatively together on a common goal with the ability to raise over $1 billion? It's only in Rotary. And it's through that partnership that was initiated by Rotary with the World Health Organization, the Centers for Disease Control, and UNICEF, the largest public-private partnership for health ever created. In fact, it's the largest ever internationally coordinated public health effort in history. And today, this effort is changing the world. We are very grateful for the Gates Foundation joining our cause. I'm not sure where we would be without their funding and without their advocacy efforts. And you have the benefit of, sharing in his generosity with the $35 million that he will match, given by Rotarians and Rotary clubs for this year and next. And I urge you to take that back to your club. Good stories truly make Rotary's history. It makes our world history. And it's vital for generations of any age to learn of the disease that has shaped human history for centuries. I urge each and every one of you to tell Rotary's story. Be the best Rotary polio advocate you can possibly be. Wear your pin proudly and tell everyone that you see what Rotary is doing. It's not just my position to do that, it's everyone's responsibility. The coming year is a pivotal time in our eradication efforts, and funding is key. And we're looking for help from Rotary clubs everywhere around the world. You see, polio eradication has put Rotary on the world stage like it's never been before. And we have many organizations clamoring to partner with us. So not only in addition to the polio do we want to finish and help fund that, I want you to help us prepare our Rotary Foundation for the future, for what follows polio. There was an article in the February 2011 Rotarian that was titled, "Make No Little Plans. The size of your wallet is less important than the size of your dreams." The article spoke of the wealthiest families and individuals of today who answered the challenge from Bill and Melinda Gates and from Warren Buffett, pledging to give or leave at least half of their wealth to charity. Now, it was pretty easy, I think, for Warren Buffett and Bill Gates to say that. But as Warren Buffett so aptly pointed out, it is all comparative. There are individuals who give more to others every day. You see, Buffett was referring to how an individual effort can accomplish great things. And one example of that is definitely our polio program. Successful because of individuals with a passion joining together to get the job done. Our first polio vaccine may have been developed many, many years later had it not been for the individual contributions of millions of dimes. It wasn't the fact how much an individual gave. It was the fact that everybody gave that allowed the medical research to be accomplished and the vaccine to be developed. There are endless needs that exist in our world today. You know that. And we can help through our Rotary Foundation. A century ago, architect Daniel Burnham advocated, "Make no little plans. They have no magic to stir a man's blood." We need to prepare to have our Rotary Foundation available in our districts so our dreams can become bigger, better, and bolder. Sorry, I'm a raised class. The size of your wallet, remember this, is less important than the size of our dreams. So I want you to support PolioPlus so that we can finish the job by 2018 for sure. And I want you to support the Rotary Foundation so our dreams can become bigger. And never, ever forget what a large pile of dimes has truly accomplished. Every step that I take is my reminder to finish the job of polio eradication. Every child that you know, every child that you see, should be your reminder. I've looked into the eyes of the bodies crippled from polio, robbed of ever having the opportunity to walk in a normal life. So today, I don't speak to you just as a fellow Rotarian. Today, I speak to you as the voice of that mother crying beside the bed of her limp, feverish child. And I speak to you as the voice of the little girl wearing the dust of the streets with calluses so thick on the palms of her hands and on her knees from dragging herself around. And I speak to you as the voice of that young man doomed to a life on a skateboard apparatus, wearing sandals on his hands, who looked up at me and asked, "Where can I go to have the surgery that will make me tall like you?" I speak for them because here in this room they have no voice, because I've seen and I understand their hardships, and I've met them all personally. I close with a quote from Franklin Delano Roosevelt. "Our ability to work together is what will make our victory over polio endure. Because of what you have done and what we will continue to do until this dreaded disease is defeated, is come together like a family and do what we do best, lift each other up." You will hear President-elect Ravi state many times that now is our time and it may never come again. Let's be sure that in the end, we together will have given the greatest gift to all children for generations to come. So please join me, and together, let's give the gift of a polio-free world. Thank you.
Isn't she fabulous? One of the great pleasures of my life is to have first met Lee Hussey, and she so touched me, and I'm so very glad that I was able to invite her to a district conference here 2 years ago. And she not only talks the story, she lives the story. You can read that, and you heard that she's done 25 NIDs, so many other things she's done, but she's constantly out telling the story and spreading the word and encouraging people, Rotarians, to do so. She dedicates almost every weekend to travel to tell the story to Rotarians. And, you know, I encourage every one of you, if you have the opportunity to participate in an NID, and as she said, time has grown short because we're getting close there, but we still need to carry on and complete the job of eradicating polio. I love this lady. I love the work that she does. She lives the story, and I'm certainly glad that she came here to spread it to us. Thank you very much, Anne-Lee.